Before enucleation of prostate, this assessment of the urethra is very important. At the end, it should be like this. This is the sphincteric region, and then you observe the gland, the medium-sized gland. Observe the orifice. Observe the orifice, and observe the verruc, and observe the anteroposterior length. For cutting 52.0 total 100 short pulse width. For coagulation 41.5, that comes around 60, and which is medium pulse. The most important is making a U-shaped incision here. So for that, I am starting like this. You can use coagulation mode also. What happen? Up to the capsule and elevate the gland like this. This is the first step of enucleation, en bloc. And you can keep laser fiber little like this so that your precision will increase. Small bleeders will be there. You need not worry. See, I am lifting these two glands like this as one. This is right lobe, this is left lobe, and this all together as one. This is the first step. Central part, including the median, whichever is there, and now it looks like this. So to do effectively, turn this laser fiber up and go here. This is actually the floor. You can see the verruc. You can see the verruc, and then go here, turn around, and then lift like this so that it properly lifts the gland like this, like this. See the vessels nicely sealed while lifting. See the lift, see the lift. See my like no traction, no rotation, no mechanical pressure. If this is the verruc, identify these both lobes, go anteriorly. See, this is the place where you cut the mucosa. Mucosa like this. Mucosa like this. You can cut 3 cuts and then see that these two are united slowly like this, like this, like this, like this, like this, slowly going little 1 centimeter inside and uniting these two. Again, you can do second time, same area, so that mucosa is cut a little deeper. Now you go a little proximally to unite to the previous cut area, and this is very important. See this cut. Similarly, from here, 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 you can cut like this, like this, like this, and unite this. Not the roof. With laser fiber at 12 o'clock position, this is actually the floor, not the roof. I am lifting the floor so precisely with one hand, without using the grip of the, see here, the prostate gland is differentiated. What I have done is I lifted the gland from here to here, almost. See the fibers. Can you see the fibers? Yes. Now we can come laterally here like this, and already you incised the mucosa, so you go in this plane. Can you see that plane? Can you see that plane? Nicely rising. Now go to the base. Only with one hand I am doing. Only with one hand with a rotation method. You see how it is lifted up? So there, lifted. See here, lifted. See here, can you see how it is lifting up? How it is lifting up with one hand. One hand. Left hand, this is the sphincteric region. You release the mucosa here, which you have incised, and then go into this groove, so that this mucosa extra will be there. This, you got the point? So you turn. Okay, here it is extremely end of the gland. Can you see nice gland lifting up here? Extreme. This is the veru. This is the tissue which you are using, and continue this mucosal bridge and leave this. Don't cut this, and go to this plane and then turn it up in a anatomical complete enucleation without leaving any. You are not going through any of the gland. You see here the plane. This is the veru, and this is the gland on the left of the patient, and this is the plane. This is the plane. See the plane. See the plane. This is at which o'clock position? 3 o'clock. Okay. This is the floor. We lifted the floor significantly up to here. We come onto the left lobe, and I am using only one hand. So here, this is the curve of the left lobe. This is the view. Go from 3 o'clock. This is the gland protruding. Slowly you move towards anterior surface. See the gland. You have to carefully see here the gland, and go. See the gland. You see, be on this side. Be on the gland side. This is already separated. Can you see this? Can you see this? And same thing. You continue slowly like this, like this, like this. See, it's separating by, because it's a enucleation. Enucleation means there should be some. So I am going anteriorly, slowly. See my hand movements all separating. Little bit of the gland maybe. See how it is done from here to here to here to here to. See the plane. Can you see the plane here? Can you see the plane? I am going slightly towards 12 o'clock. See, 12 o'clock. Now when you come back, you will clearly see what you have done. See, this is a sphincter, this is a veru, this is the left lobe, smooth, like this. This is little rugged, but here, can you see the capsule here? Here, that you continue anterior. And this is the gland. Can you see nicely? Gland. Now I am going towards 9 o'clock. 9 o'clock to up, towards again. See, it slips. Come 6 o'clock. See, this is the veru, and this is the, okay. Go, come back little. This is the difficult part. They slip. This is the area. Okay, this. Follow the same area. This is the area. At the entire surgery you have kept, when you are doing the floor, you have kept the laser fiber at 12 o'clock. See here. This is the right lobe of the patient, left side of the screen, and here you need not go here. This is the capsule. Can you see that? You are going deep. So can you see raising? Can you see? Can you see? Come back and see. This is the plane of the C. Are you able to lift it clearly? Here there is little deep we have gone. Correct it now only, and then go anteriorly like this, and come back little. Can you see the plane? See, like this you go and unite. Can you see the plane? Beautiful plane. Here, this. You see this? Yeah, this is little perforation area. Come towards the gland. See, it's meeting here. Can you see this bridge recording? Yeah. Now they are united. Can you see here? See, united. Okay? Like this, like this, like this, like this. These are small fibers make united to the opposite side. See here, 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 here. Can you see that? Veru. This is the veru. I have gone on the right side of the gland, completely onto the gland, completely onto the gland, onto the gland, onto the gland like this in the retropubic region. Then I am coming opposite side, completely like this, come back and see, I have united this. If you do like this, see again reverse direction I am going. See the gland, see the gland, see the plane, see the plane, see the plane, see the plane, and in no time I am coming back to this position. So these two are lifted now. See, can you see? Entire thing is lifted without affecting the sphincter. You cannot go and do like this here. See, this is intact. Going towards the laser fiber at 6 o'clock. This is at 12 o'clock position of the surgery. That is at the bladder neck. So I am about to open the bladder neck to the simple sweeping movement, right sitting on the, see, it's clearly opened. Okay? Vijay, you are watching? So it's opened at the bladder. You open the bladder, you come like this. It is easy to sweep in this region, isn't it? Then go back with single hand only I am doing. Go back, back. You already lifted here. You already lifted here. Can you see that lift? Here, here, here. You have already lifted below also. See, nicely. Can you see here? Nicely towards the gland. You are taking the curve like this. See the curve. In small glands, medium glands, it is easy. In large glands, you see, this is the perforation area. You come back here, 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 here. See how it is. You come back here, come back here, come back here, come back here, and unite to the previous plane. Got the point? This is the both glands lifted. This is a right side gland on the left part of the screen. This is already lifted here. You can observe a lot lifted here, but not lifted in the side. So this you go, see this type of plane, if you see this type of plane, it's a beautiful surgery. Then you are in the correct plane and you are going towards the bladder neck. So reverse direction. So again the vessels will burn in no time. See, you have already lifted this gland. See, this gland is lifted, and continue that towards. See, these are the small bridges you have to break, and then go in this plane. No perforation here. Clearly vessels are seen between the pseudocapsule and the peripheral zone. Doing the roof to floor, you can use the laser fiber at 6 o'clock position, but you should be careful that you should not go deeper in this plane. See, this is the gland. So you are sweeping like this, like hockey incision, like this, like this. This is called hockey incision, like this, like this. This is the most easy part of the surgery. But without doing the floor, if you do this, you will be difficult hanging the gland in an en bloc resection. Now you come back and same hockey stick incision, you continue like this and keep on lifting the gland. This is easy in the medium sized glands, but difficult in the right. This is a coagulation like this. You should be really oriented. For that orientation, bladder is the only guide. At this level, hockey stick incision, which we have done on the other side, we are uniting perfectly, keeping the see, can you see the pre-attachment here, and then cut it. Don't go into the trigone. If you want, you check once like this. See, gland is falling. So let's push the gland. This is the difficult part if you keep very small hanging edge. So slowly, before it rotates, you should finish. Before it rotates, slowly, don't push. It will push by itself. And now the entire surface I want to show like this, and now small bleeders you can coagulate, not all the things. I carefully identify. You can coagulate like this, outflow on. These are not bleeders, they are all only. So is there any bleeding significant? No. So usually in enucleation, that significant bleeding will not be there. So this is the en bloc resected specimen, which can be, see, you can see nicely. See, okay, can you see the mucosa here? See how precise the laser is. Then that is all. Picture at the end of surgery. Immediately I have taken over. You can see there is no mucosal injury, and you can see clearly